Hello dear student, welcome to the clinical microbiology next session, that is approach to competency based medical education microbiology curriculum. Myself Dr. Jigar Gusani, I am MD microbiologist, and why I have selected this topic is because there is a biggest change amongst all the subjects in the MBBS curriculum is in the microbiology, and it becomes difficult for student as well as for the teachers also to shift to this big change. So let us see what are the objectives of today's session. So I will cover the overview of the changes which is suggested and released by MCI and now being implemented under NMC. So it is change from organism based to systemic infection based curriculum. So how to approach or how student as well as teacher should approach for this CBME based microbiology curriculum. What is the change in the duration of the course? What are the changes in the assessment patterns? And the most important aspect is continuous feedback should be given to the student. So let us take these steps one by one. So the first change is approach in the curriculum. Initially, the microbiology was being taught as an organism wise, right? On the left side, you can see the organism that is cocci, gram-positive cocci. Now in CBME, uh, these infections caused by various microorganisms, they are now being categorized and classified as clinical presentation or syndrome, system-wise infections. And in system, the relevant microorganisms are being discussed. Okay, so let us see what was in the classical medical microbiology approach, where the microorganism were being taught in detail. So whether they are uh, cocci or bacilli, then again further divided into the characteristic gram positive cocci or gram negative cocci. So in gram positive cocci we have staphylococcus. The image in previous slide which was shown was of staphylococcus, gram positive cocci, and the second most important is streptococci. So this was the way the organisms were being taught, right? So there was an entire separate chapter on staphylococci. The staphylococci was being taught under many headings like morphology, microscopy characteristic, culture characteristic, what kind of colony appears, what are the biochemical reactions, then which are the virulence factor overall for staphylococci, what is the pathogenesis, then which are the different clinical manifestation, which can occur due to staphylococcal infections. So they can be involving various systems and it will be of wide variety. Even the lab diagnosis is in general pertaining to staphylococci. rather than any infections caused by staphylococci, right? In CBME, what they have done is syndromic approach or system wise infection. So the infections are being categorized as per the system involved. Here, staphylococcus will be discussed in detail in SSTI, that is skin and soft tissue infections. Why? Because it is the major pathogen which causes skin and soft tissue infection. However, first the clinical signs and symptoms of staphylococcal skin and soft tissue infections will be enumerated, and then the virulence factor which are responsible for this skin and soft tissue infection will be discussed. Same way, laboratory diagnosis pertaining to these infections will be covered, and even the treatment options will be discussed pertaining to this infection. So here the infection or the system wise infection is discussed, and then the major pathogens which causes such infections are discussed, and all the relevant topics are discussed pertaining to uh, those infections, so that the student will get the knowledge how to treat, how to manage those infections. The only drawback in previous microorganism based approach was the student were getting the knowledge, but they were not sure how to apply this knowledge clinically in daily practice. And we want to make our student competent, where they can perform as a referral physician, first hand contact physician, and they can treat and manage these common infections. Okay, second is general overview of microorganisms. Now, it is not like that the clinical microbiology is the only option and there is no role of microorganism based learning. No, actually the microorganism based learning is the pillar or the base for the clinical microbiology. Without understanding the microbes, we cannot teach our students systemic infection. They will not be able to understand these infections and infectious agents. So in a general overview of microorganism, what we have done is that before going into teaching of systemic infections, we are teaching our student what kind of various common bacterial, viral, fungal and parasitic agents are involved in various infections. So here we will enumerate common bacterial organisms and the infections in brief will be named and discussed, right? Also various laboratory techniques which are used. So overview of these techniques like culture, antimicrobial susceptibility techniques, these will be discussed under the general overview. Same way for viruses, viruses will be enumerated they'll be classified like DNA virus, RNA virus, their name, and the name of infections they cause, laboratory diagnosis overview, okay, and the treatment option. Same way for fungus and parasites. Even in parasites, the overview of life cycle is very important, right? So these overview are being discussed in the initial chapters, so students are sensitized that what kind of different microbial pathogens are present and how we can utilize various tests, what are the options available for the diagnosis of various infections. So they will have the generalized idea that what are the options available, and they will have the knowledge before going further into systemic learning of systemic infections, right? So once this knowledge is achieved, it is being followed by learning of systemic infections. Okay, now the third is competencies are introduced instead of organism based topics. So what is competency? Competency is basically, if you want to define, it is the ability to do something successfully and efficiently. And CBME, the core content of CBME is towards making our graduate student competent enough so they can fulfill the requirement of the patients and the society, and they can manage these infections, common infections, efficiently, right? So in CBME microbiology, they have given major 8 topics, right? And under each topics, there are various competencies, right? So number of competencies are mentioned under each topic and the system. They've also provided a document. MCI has given the document which describes these competencies and how we can teach and assess these competencies. So just to understand this, here MI means microbiology. It's a short form or the code given for the microbiology. The first letter 1 is belonging to this first topic, which is general microbiology and immunity. So MI1 means it is the first topic of microbiology that is related to general microbiology and immunity. In that topic there are 11 competencies, so which will be mentioned after 1.1. So this point 1 means this is the first competency under the general microbiology and immunity, right? And these are the domain level, and whether this competency is core competency means students must learn this, right? The suggested teaching learning method and how teachers can evaluate these competencies. The methods for assessment are also mentioned. So again, topics are numbered as MI1, MI2 up to MI8. Under each topic, competencies are numbered as like MI 1.1, MI 1.2, MI up to MI 8.16. Under each competency, sub-competencies are numbered as, we can further divide these competency into sub-competency as well as the learning objectives, right? So these learning objectives a department or university curriculum committee can decide uh, for their institutes, so that the teacher will be able to fragment these larger competency into a smaller sessions, and student can achieve learning of these competency as a whole. Fourth is the spatial emphasis on the clinically relevant important competency, right, which were not being formally taught initially. So These are like healthcare associated infections, right? These are very important topics, but now being covered in detail, right? Healthcare associated infections. Then, what are the basics of infection prevention and control practices? This is very, very essential for any MBBS student, that they have to take these precautions while practicing in the hospital or clinic or in the healthcare setup. We have already seen that in pandemics like COVID or H1N1, the importance of these practices becomes enormous. However, it should be performed regularly on day-to-day basis, whether there is any epidemic going on or not, right? So these are the standard practices and must be followed by all the healthcare personnels. Another important point is antimicrobial resistance and antimicrobial stewardship. The WHO has recognized antimicrobial resistance as a global threat and next biggest pandemic the world is facing. And so all medical graduates should know how to use antibiotics judiciously and which are the wrong practices going on currently, and they need to follow the antimicrobial resistant pattern and prescribe the antibiotic according to the guidelines, and that is antimicrobial stewardship. Another new topic which is introduced is ADCOM in laboratory medicine. ADCOM means ethics, communications, skills in the field of medicine, right? So they have also provided certain competencies for laboratory medicines like confidentiality into lab reports. So before releasing certain sensitive lab reports like HIV or sexually transmitted diseases, right? What are the aspects of confidentiality? Same way, showing respect and doing proper communication to the patients who appear for the lab tests. Also, there is a competency they have given is selection of an appropriate lab test and interpretation of lab results. This is very crucial because in previous microorganism based approach, there were various tests were given under the single microbes, and students were not being competent enough that how should they select a particular test for a particular patient and for a particular infection. So here this portion is being covered, and it will make a major change. Then moving to the allotted hours and total duration, here the drastic reduction has occurred in the total duration of the MBBS second year, right? Entire second MBBS teaching must be completed within 11 months. Previously it was 16 to 17 months. So now we are getting very less time. So it will be difficult for student as well as teachers, right? Now, moving ahead in the assessment of the CBMA microbiology curriculum. So, what they have emphasized is focus more on the formative assessment. So, these formative assessments should be very frequent and continuous along with the course content. So, every monthly or bi-monthly, a small formative assessment should be carried out by the faculty to know whether the student are able to learn, and we may able to provide them certain feedback, right? Then the internal assessment, there will be 3 internal assessment examination, out of which there will be one pre-university or also preliminary examination, in which entire curriculum will be covered in the assessment. And then the final university summative assessment. Here the student will have to write 2 theory paper, each will have of 100 marks. So marks are increased for both the paper, and as well as for the practical, 100 marks of practical. uh, the student should know here that they have to secure at least 40% mark in each of the two paper with minimum of 50% aggregate mark of both the paper together for as a passing criteria. So they have to get the minimum 50% mark and at least 40% in each of the theory papers. Now, what type of questions can be asked in this CBME based approach? So, the major type of questions are clinical or case based questions. Here, the student will have brief history of patient, initial diagnostic workup, based on which they have to write the most probable clinical diagnosis and then identify the causative organism. Here also emphasis will be given more on common infections like TB, malaria, HIV. So all those common infections which are prevalent in India, right? They will be asked more in detail, their pathogenesis, laboratory diagnosis, what are the treatment options available, antimicrobial resistance pertaining to this infections will be asked. Then also there will be separate questions for preventive measures for community acquired as well as for the healthcare associated infection and infection control practices. Also there will be compulsory question, compulsory, this needs to be emphasized, compulsory question on AdCom from the bioethics, communication, confidentiality. So student must learn these AdCom competencies. Now let us have one example of case-based long question. Here the case scenario is given. A patient comes to the medicine OPD with a burning micturition and pus discharge from the urethra. So it is a case of urethritis, right? So this is the first indication, syndromic approach, right? The patient also gives history of sexual contact, recent and repeated sexual contact, uh, and then the initial workup, microbiological workup shows that there are multiple gram-negative diplococci within the pus cells. So the first question will be the most probable clinical diagnosis. That means student have to write the name of the clinical condition, likely conditions, and the organism which is responsible for these condition. Then the rest of the questions will be based on this infection as well as the organism, right? So student have to identify the syndrome and the causative organism. So to summarize, it's a very major change in the microbiology curriculum uh, from microorganism based curriculum to clinical oriented microbiology curriculum, and I would say that this can be called as a mini infectious disease course, right? So here the organisms are not discussed separately, but they are being discussed in system wise infection, and they can be present in multiple system. A single organism can cause multiple infections and the presentation will be different, right? So the student will have the knowledge of infectious disease rather than a thorough knowledge of organisms only. There will be emphasis on various clinically important competencies like healthcare associated infections, infection control and prevention, antimicrobial resistance, right? The course duration has drastically reduced, and students should know the assessment pattern, because based on the assessment they have to prepare themselves, right? And what are the different type of questions which can be asked?